Hi there. Welcome to the Health Analytic Insights Podcast. This podcast is all about creating a community of like-minded individuals who are passionate about the field of health informatics. I hope to share information and advice in topics such as health analytics, digital health, biomedical engineering, and data visualization in healthcare. And in exchange, I would love to hear from you, dear listener, about your experience and interest in this field. You can drop me a line at HealthAnalyticInsights@gmail.com, and this email, along with any references discussed during this podcast, will be listed in the show notes below. If this resonates with you, don't forget to follow and subscribe to this podcast, as I'll be releasing new episodes bi-weekly. 2021 and 2020 brought unique situations when it comes to the digitization of healthcare. Telehealth was rapidly adopted during the pandemic, and with healthcare workers being worked to the bone, relying on digital tools to help reduce their burden were at some of the front line of the health informatic professionals. In this podcast episode, I want to go over some of my beliefs of where I see health tech trends being further developed in 2022. Without further ado, let's get into it. So the first health tech trend I think will hopefully really blow up in 2022 is the use of natural language processing. And this is a subset of artificial intelligence, which I believe can have huge benefits for the healthcare field due to the massive volumes of data, specifically unstructured text data, which is collected daily from healthcare organizations. So in previous blog posts and podcast episodes, I've talked about clinician burnout. And I believe that one way to help reduce clinician burnout is to reduce the amount of manual data entry that has to be inputted into EHR records. So helping to auto-populate the EHR records, I believe is one way to reduce the burden on the medical scribe or clinician so they can spend more time face-to-face with the patient instead of just staring at a screen. And when it comes to the administrative side of healthcare, integrating healthcare chatbots, which use natural language processing to answer frequently asked questions, can be a way to reduce the administrative load for healthcare organizations. And in some cases, we even saw the use of these healthcare chatbots during the pandemic to help guide people and answer their questions when it came to coming into the hospital, what questions they needed to answer, and what precautions they needed to take. And this can be a lot more beneficial than just having someone answer the same question over and over again, tying up the phone lines, and patients being on hold for long periods of time. Instead, a patient can log into a patient portal and get their question answered. Of course, lots of work will have to be done concerning sentiment analysis, so ensuring the chatbot can understand the tone of the patient if they become sad or irritated, so that staff can immediately intervene. As a whole, natural language processing can definitely be beneficial to help sift through the massive amounts of text data output by healthcare organizations. So the second health tech trend I'm really excited about is personalized medicine. So with the rise of health tech gadgets such as Fitbits and health apps to help you track your sleep, fitness level, fertility, etc., more and more people are becoming interested and invested in learning about their own personal health. So with this knowledge and access to their healthcare data, this could manifest in a different relationship between the patient and care provider. Instead of the clinician just speaking directly to the patient about their symptoms, with this knowledge, some patients can move towards having conversations about their health once patients are empowered to learn more about these digital devices. And in addition, I think it would be really valuable if patients can track their symptoms over long periods of time, and so they can have this information to directly speak to the clinician about and not just be unsure about symptoms that they have. If they can track this information directly in an app and say, on this day I was feeling a certain way, on the next week I was feeling a certain way, I think this can really move towards having more rich conversations about health instead of just having a one-sided model. And in some cases, the clinician could even lean on the patient perhaps for some of the data entry aspects. For instance, filling in their current address and if any of their symptoms have changed recently prior to their in-person or virtual meeting. And the hope is that the conversation can move towards one that's more collaborative on how best to manage care. And I feel that if patients are empowered about their own health, this will cause them to buy in, be more willing to take the advice of the provider because they're also now invested in their own health. The next health tech trend, which I think will even develop faster than in 2021 and 2020, is telehealth. So telehealth and telemedicine had a big boost during the pandemic globally, where patients were able to realize the cost and time savings of having virtual meetings. And I hope that for routine checkups, the option for telehealth will remain, because I think that it will allow people to make the time to see their clinician more often, act as a preventative measure, and potentially catch preventative diseases, and reduce barriers to seeing a doctor, as some people might not be able to get time off work, and hopefully this will all move towards reducing no-show appointments. Overall, I think this will be a huge win and a reason for this healthcare model to remain as a permanent option. Of course, there's many things that need to be settled with telehealth and telemedicine, such as billing, how to properly educate people who may not be tech savvy, people who live in remote areas not having the best connectivity. These are all things that have to be dealt with, but I think that telehealth and telemedicine in some cases can be a superior model, and it'll be great to integrate this into our current care options. So the next health tech trend to watch in 2022 is FHIR, which stands for Fast Health Interoperability Resources. And this is a standard which is developed by HL7, which is allowing greater interoperability between healthcare data sources and even the ability to build apps on top of existing infrastructure. And this is really great because I was listening to This Week in Health IT, which is a wonderful podcast. I will link to it in the show notes below. And in one of the episodes, they were talking about a designer who's trying to get surgeons to agree on one product design. And it was just not possible. Everyone was firm in their beliefs of what the design should look like. So when it comes to healthcare, there will always be a degree of customizable features that clinicians would like to have because there's great variability between patients. And so I think having customizable features, especially within the EHR, and allowing for data to be exchanged between different healthcare organizations more easily will really be a huge benefit for healthcare analytics and overall help to improve and drive patient outcomes. So we see cases of this already happening where EHR vendors such as Epic and Cerner are partnering with big names such as IBM to carry out healthcare analytics through open APIs, which allow for data to be shared and data insights to arise. And so the final health tech trend I think will take off in 2022 is voice-to-text technology. So when it comes to, again, reducing that clinician burnout due to excessive data entry into the EHR, voice-to-text is a way to reduce the constant scrolling and typing clinicians have to do, taking time away from their patients, and in some cases adding to their long day. So the future is not just transcribing what the clinician is saying into the EHR, but to go as far as treating the EHR like Google Nest or Alexa, where the clinician can ask questions to the EHR and get quick responses back. So there will have to be, again, lots of work to recognize different accents. There will have to be flags built into the system where transcription errors can be flagged easily because we don't want to get into a situation where now clinicians have to spend the time scrolling through the EHR to look for transcription errors that might have been a result of the voice-to-text technology. So again, there's lots of work to be done in this area, but it will be really amazing to treat the EHR as an Alexa type where the clinician can just ask for what's the patient's weight, what's the patient's address, and immediately that answer is just relayed to them. So these have been the 5 health tech trends which I hope to see rapidly take off in 2022. So how about you? What tech trends do you think we will see in the healthcare field? You can email me at HealthAnalyticInsights@gmail.com. I would love to hear from you. Have a wonderful holiday season, and I will see you in 2022. Thank you for listening to the Health Analytic Insights Podcast. I'd love to hear from you about topics I should cover in future episodes. Please consider subscribing and leaving a review. Have a wonderful day.